All right. Thank you, everyone. Our next session is Reinforce the Patient Voice, and it's going to be moderated by Dr. Sunil Joshi, the Chief Health Officer of the City of Jacksonville, Florida, and President of Family Allergy Asthma Consultants. Again, a long, very impressive bio that I have had to cut down. But more information on the website if you want to know more about all the folks here. He is the current president of the Duval County Medical Society Foundation and co-chairman of the foundation's #FluVaxJax initiative. Love that. That's great. The foundation is also working on ways to minimize food deserts and gun violence in Northeast Florida. And he is most proud of the efforts of the foundation in helping to reduce the rate of physician burnout in the Jacksonville area. So over to you. Thank you.
Thank you so much, and thank you all for being here. I'm excited to moderate this session as an allergist, immunologist. I definitely see patients and families who deal with food allergies all the time. But before I start, I have to acknowledge that Dr. Perez, who was here earlier, I was born and raised in Jacksonville, and I did my internal medicine residency at Mayo Clinic in Jacksonville. And she was one of my esteemed attendings and really got me excited about medicine in general. And so to be here at something that she's helped to chair is really meaningful for me. So thank you, Dr. Perez, for all that you do for food allergies, but just the community in general. So we have three amazing individuals here who live in the food allergy space on a day-to-day basis. And they have a lot to say. And so I'm going to let them introduce themselves first, and then we'll get through the session. So.
Hello, thank you for inviting us here. My name is Diallo Sims. This is my son Amari. We live in California in the Bay Area. I'm an educator. I've taught high school, and I'm currently teaching middle school, 7th and 8th grade, and I'm a science teacher. And my son used to go to a different school, and now he goes to my school, and I'm actually his science teacher.
He better do his homework.
It's very interesting. We have great days, and then there's some days where he's like, oh, I'm with my dad again. So it's definitely a roller coaster, but it's something that I dreamed about. I'm so glad he's in my class. And yes, I'm here to speak about my experience as an educator and a caregiver, and there's lots of interesting things.
My name is Amari Sims. Good morning. I'm also in San Jose, California, and I'm allergic to peanuts, tree nuts, and sesame seeds. And I have to say that allergens have really impacted a large part of my life.
Hello, I'm Elani Wiest. I live in Jacksonville, Florida. I'm a staff scientist at Mayo Clinic, but I have 2 children with food allergies. I myself have a food allergy, so we manage 7 food allergies in our household. We've been through daycares and now elementary school, and I'm also a support group leader for our local food allergy support group.
Thank you. Thank you, guys. And so I'm going to start with the 2 parents in the room here. So having a child with food allergies, and in your case, Alana, you have food allergies yourself, definitely affects your life. And so I'm curious, from your perspective, how's that affected you both personally and professionally going forward, knowing that you have to work around food allergies?
So it started with my son. My son has had 25 EpiPens in his short life. He's 7 now. And so starting with daycares and educating daycares and seeing that the need to educate them, not just how to give epinephrine, but when to give epinephrine. So it started there. I co-founded a project at Mayo Clinic where we educate daycares on epinephrine education. And as my job at Mayo Clinic, I'm also a well-being expert, well-being champion. And in our department, I just realized how many of our events are driven by food. And so we have now we only host events where everyone can have something to eat. And we have signs stating that. We have 3 people in our department with shellfish allergies. And so shellfish is a no-go at any of our events. And we are working on a sign on our microwaves to say no shellfish to be heated in these microwaves to also create inclusive and safe work environment. Because if we take care of ourselves, we can take care of the patients as well.
Yeah.
As a parent of a child with allergies, the challenges have kind of changed as he's grown up. I remember the first day he had an allergic reaction. I think I gave him some peanut butter crackers. We didn't know what was going on. And then finally he got diagnosed, with some tests and things like that. So it hits you with like a ton of bricks at first, cause you're kind of like forecasting and speculating about his whole life. How's this going to play out? What's going to happen when he goes off on his own. So as a baby, we kind of control the narrative, shopping, safety, watching his food circle, packing all the lunches, and just basically hovering, right? Academically and, with the allergies. So it was tough, but we could control the narrative. And then as he kind of got older, and started, kind of venturing on his own, the challenges have changed to, parties and schools and, dances. While most parents are worrying about who are they going to dance with, we're worried about what type of food. In middle school, it's boys over here, girls over here. So, we don't worry about that. But it's just like, what are they serving at the parties, and the school dances? So going out on his own was, a very big concern. Also, how are people going to react to his allergies and how are they going to treat it? Are they going to respect it? And will he be able to advocate on his own? So in March, just a quick story. In March, we were coming home from, Congress, Courage of Congress. And, on the airplane, we typically announce to the flight attendants, can you make an announcement, about, we have allergies and, please no one within this row eat peanuts and so on and so forth. And usually the flight attendants are fine with it, but, he witnessed, the flight attendant responding and saying, well, if he can't handle people eating around him, you might have to get off this airplane. And they started threatening to kick us out. And, my wife escalated it and in a good way,
That's what moms do.
Yeah. And so it escalated all the way where the flight attendant was, pulling other people in, other stewardess, trying to get her to back her up. And they had to pull in, the main, flight attendant who was located back in the airport. She came on board and finally said, whispered in our ear, like, oh, I have food allergies myself, so I understand. And she told the other flight attendant to kind of back off and we'll make the announcement, things like that. So it was great to see us advocate. He saw how he's going to have to advocate for himself when we're not there and we're at home and he's at college and so on and so forth. So the challenges have changed over time. And it's been a great growth experience and, being a part of FAIR has totally changed, and lowered our anxiety level and has allowed him to grow and move forward through this journey.
Yeah, and it's a lifestyle change, right? As you go through things that other people don't have to deal with. And Amari, you're the one who deals with it directly. So how has that affected you in school and through your life and just interacting with friends?
Well, when I go to the grocery store, for example, I really have to look at all of the allergens, and sometimes the bread, there's been a law or something like that discourages the use of sesame seeds, but there's always the chance, and they usually put sesame seeds in, so there's not a may contain label, and that's just been harder because I remember one time we were trying to find hot dog buns or something, and then they all had sesame seeds. It was all either may contain or it was one of their last ingredients. So that's definitely been an issue, and even when I go to school, I have to make sure that I'm safe and that people around me don't have any peanut butter, peanut, or sesame seeds. And one time when I was in 6th grade a few years ago, we had to eat inside because it was raining outside, so someone probably brought a PB&J sandwich, and then I got allergic reaction in my eye, and I didn't know what it was from, and then I had to go to the office, and that was one of the humbling experiences that I had. And even at parties, I have to make sure either my parents or I tell the parents of the child that has the party to remind them that I have allergy and to hopefully accommodate for that.
Yeah. I mean, those are obviously those affect you. I mean, compared to your friends and even your sibling who may not have food allergies, right? So these are impactful moments in your life that make you also understand that you are dealing with things that your friends aren't, right? So hopefully your friends are more accommodating than they have been in the past too. Well, that's great. So this also leads me to something. There was a discussion earlier about allergists and training. And as a board certified allergist, it is one of the things that frustrates me, and I'm sure frustrates many of the allergists in the room, is the misinformation that goes out there about allergies in general. So allergies in general, but then food allergies in particular. And how that might impact our patients and families that actually do suffer with true food allergies. So people label everything as a food allergy nowadays. So somebody who has celiac disease says that they're allergic to gluten. Well, in fact, they're not allergic to gluten. They're not going to have an anaphylactic reaction if they eat gluten. Or if you have a lactose intolerance, you're not allergic to milk. You have an intolerance to milk. And so, and I had a patient come to me the other day and said, I had jalapenos on my pizza and my tongue was burning and my nose was running. I'm like, well, that's not an allergy to, now if you're an Indian, they might consider you crazy for not being able to eat the jalapeno, but that's not an allergy. That's a different issue altogether. And so the problem with that is what that does is that as the general population looks and sees, okay, that person has milk and now they might have bloating, diarrhea 3 hours later, or somebody who has celiac disease can't have gluten, but they're not going to die if they have gluten. They call that an allergy, and they miss the folks who have the true allergies out here to peanuts and milk and eggs and sesame. And that becomes part of the challenge when you're trying to get on an airplane. It's like, oh, he doesn't really have an allergy. It's not a big deal. And so you lose the reality of what a food allergy is. And so my question to you all is, then how is that especially for the parents here, how has that misinformation about food allergies affected you? Have you seen it? And how does that impact how you deal with food allergies on a regular basis?
So I can tell you about a time when my son started kindergarten at elementary school, and I said, hey, we need a 504 plan for his food allergies. And they came back and said, oh, we don't give 504 plans for food allergies. And I had to advocate. I had to say, hey, you have Play-Doh in the classroom and he has a wheat allergy. You have pizza parties. You just had an outing to a pizza place and he can't enjoy that. These are issues and it's his right to have a 504 plan. And the view they have is, oh, bring the EpiPen, we'll just leave it in the office. And being married to a physician, my husband said, no, I'm going to come to the school. I'm going to show you how to give the EpiPen, but I'm also going to teach you when to give it, because this is just as important. And bringing home that message of it's not a diet, it's a disease, and it is life-threatening, and you need to take this serious. So I think that information on how serious it is and it can be life-threatening is just not communicated very effectively, and people are unaware of it.
Yeah.
And as an educator, I've been teaching for 20 years, believe it or not. I would say 20 years ago, there was no consideration of food allergies. As time has passed on, I think now everyone is more aware of it. We're taking more notes, and it's in this student roll sheets, who has what allergies and things like that. But I still think teachers and staff are still misinformed about food intolerance versus food allergies. So once my son started going to the school, and it kind of elevated my need for the staff to really understand what the difference is. I've had to work with the administration. I've had to work with the cafeteria. I've had to talk to the superintendent about making sure like their teriyaki sauce doesn't have sesame oil in it. And there has been some major changes. I've learned how you have to network with the higher ups in order to get change at the lower level, because the cafeteria person is not going to make those changes on her own. And so I've given speeches about how to use the EpiPen and how teachers need to, not give food treats in class. And it's just been, it's every week it's something. So these kids do have, we've started a safe space in my classroom where kids can come and eat. But still a lot of people don't understand that it's life-threatening versus I just don't like milk.
That's right.
So it's a constant battle.
Right. I don't like spinach, but I'm not allergic to spinach, right? I mean, there's a big difference there. And, you know, some of this does come back to education. Someone had brought up the question about medical education and it's a true fact. I mean, most of the major academic centers in this country do not have allergy programs and they don't train allergists. And so you go through training and it's not just medical school. It should really be at the residency level where residents are trained in allergy. And it's not just food allergies. It's allergies in general. People don't understand what we do as allergists. And on top of that, don't understand how to manage allergic conditions. And so, that training, so part of the misinformation also comes from providers that are not allergists, pediatricians who are doing blood allergy testing on everyone who comes through the door, and we get all these false positive test results. And these folks think they have allergies and never had a problem eating eggs in their life. And how can you compare that to somebody who has a life-threatening allergy to eggs? And that's where our job is as allergists. We spend most of our time telling people they don't have an allergy, you know, as opposed to confirming the ones that do. So that is important. And so then it comes back down to advocacy, right? So some of these folks who don't need EpiPens are getting prescribed EpiPens, which now makes the access to EpiPens a little bit less for the folks who do need it. And so both, Diablo, Amari, and Alani, all three of you guys have advocated for having more access to EpiPens. And so I want to just kind of hear from you all. What are the challenges? What are the reasons why you're looking into doing this? And how's that process going, bro?
Yes. So I touched a little bit on this program from Mayo Clinic where we have physicians, medical students, and residents go to daycare centers and educate them on anaphylaxis and epinephrine. But the big question that comes in is how do we get stock epinephrine? Because in Florida, it's legal to have stock epinephrine at schools and public places. However, when I called around to find epinephrine as a stock at schools and churches and so, it's more than $300. And your average daycare center does not want to spend $300 on epinephrine. And then they are very scared to use something that was not prescribed to a specific child. So a child is having anaphylaxis. They are very scared to give stock epinephrine to a child who may not have a diagnosed allergy but is experiencing anaphylaxis, or do have one but their parents didn't have money to send more than one epinephrine. So the cost associated with epinephrine, even as stocks at schools, is really limiting our families to get access.
And for advocacy, it's important. And for epinephrine, yeah, they are really, really expensive. And it's important to advocate for the lowering of the cost, because I have an EpiPen right here, and this is like more than $600, and this is a lot. And the medicine inside is only like $1 or $2.
A quarter. It's like the medicine is cheap, really cheap. Yes.
So they're upticking the prices by a lot, and that's really not okay for a lot of families because they can't afford this every time it expires, because it expires quickly too, and that's not right to have to buy it like every year so that your kid can have a life-saving device. And also it's important to advocate because a lot of people might not know and might not know how to treat people who have allergies. So that's really important.
And he's taken on this epinephrine challenge all by himself. So I want to let him speak to what he has been doing in order to secure epinephrine pens for everyone.
So I'm making a price cap bill in California, and I'm starting to work on the federal level. So it's Thank you.
No, go on. You're talking.
Yeah, and it's to lower the price from $60 for a 2-pack to from more than $600 to $60, and that's a big change, and that will make a lot more people be able to buy it, because at this point they have to choose between like maybe going hungry or paying rent to buying an EpiPen to save someone's life. That shouldn't be a choice that they have to make. And they and saving up for all that money is super hard, and it takes a lot of work. And I know some insurance companies might not give you enough money to buy those epinephrine auto injectors, and it's really tough for the people that can't afford it because they have to be really careful and really diligent.
Being a part of FAIR and going to the summit and things like that really changed his life and our family's life too, because we kind of felt all alone. And then my wife discovered FAIR, and then we started getting involved in the community. And when he went out there, he saw other kids within the teen summits and things like that, and he saw it. Well, I can be active and actually make a change. So it went from just our small family to our school family. Then it just kept growing into local circles. He's met with local city council people. He's met with Dan Cortese, and we've been working with Jason Lindy in the back. We're bothering him all the time. I don't know if we're bothering him too much, but it's really been great for him. And he's kind of led this drive all on his own, because between teaching and 2 kids and school and watching sports, I'm a busy guy.
Yeah.
So,
there's always sports on.
Always sports. So he really has led this charge, and working with FAIR has just been a wonderful opportunity for him and our family. And we just thank Miss Anita Roach for this opportunity to come in front and speak with everyone and everybody in FAIR.
Yeah, that's fantastic. Oh, yes. Yeah. Yes. I put Dr. Press in the corner.
So I'm an area, perhaps just so you know and other people know, because just have an idea, how about dealing with copays? Because that could be a way that is more palatable than a drug company dropping the price from 600 to 60.
Mm-hmm.
But the main issue here is copay.
Right.
For a lot of insurers. And then you can think about the Affordable Care Act. I don't know how that impacts this at all, but I think it would be very appealing to eliminate copays,
Mm-hmm.
because it's a life-saving medication, and that could be an easy way to get in, and nobody can say no to something like that.
Yeah. And so, and that sometimes is how these drug companies utilize these, rebate cards and, to reduce copay costs or out-of-pocket costs. But that works for people who have private health insurance, right? So government insurance, Medicare, Medicaid, and also, people with TRICARE, or people without insurance, it doesn't really help them as much in those situations. And that's sometimes where the barrier does come into play. But it's a great question though, because this is an opportunity for the public, not-for-profit, private sectors to kind of come together to reduce costs of drugs. And you see that happen sometimes in other sectors, and we should certainly consider that in the allergy sector. So not just for food allergies with epinephrine and Abique and all of these things that can be expensive, but some of the biologic agents that we use for asthmatics that some of our underserved community cannot get access to because of cost. If we could come up with a way for even hospital systems to help us reduce the prices, because they actually, would win in those situations if these folks aren't having to come to the hospital for their anaphylactic care, and that may be uncompensated if they don't have health insurance, right? So there are ways in which we can bring groups together to make that happen. It's actually a really good point, actually.
That make your day-to-day life better, health policy needs to change to help not just but everyone around you. And I just want to applaud how amazing you are at such a young age. And it just really wants me to ask the question of, we talk a lot about the barriers and the problems with having food allergy, but there's some positives too. And I'd love for each of you to speak about the positives that having been affected by food allergy have brought to your life, and how we could also talk about those.
Yeah, that's a great question. There are definitely some positives too. Like, for example, I know how to read labels. I know, what's safe, how to read the label, and if there are too many ingredients that I can't pronounce, then it's probably, bad for me.
Yeah. Good for you.
Cooking with your sister.
Yeah, and I've learned to cook with my sister and my family, so that's definitely a great skill to have in life too.
Are you better cook than your sister? She's sitting back there. Who's it?
And it's also healthier since you stay away from a lot of different ingredients, and that just lowers the risk of like having a lot more like foods that are worse for you.
Yeah, it's great, Alani.
So I think that being a food allergy parent has really, my parenting style have taken a turn. It's not the way that I thought it would be, but the good thing is that I have a 7-year-old son who advocates for himself, and he tells the cafeteria staff, this spaghetti doesn't look like the ones you gave me last week. So can I read the ingredient list? And so, I'm just so proud of how he's turned out and how he's advocating for himself. And now teaching him to do it in a very respectful way. And I love seeing his little friends' parents would call me and say, we had someone over for dinner and my son told us that we should ask them if they have food allergies, and we've never asked anyone who come over for dinner if they have food allergies. And so instilling that, and through him advocating and him speaking up for himself, he's making change everywhere. So I think I never thought that I would raise kids to speak up for themselves so early, because I think 7 is pretty early, but seeing that really empowers us and makes us more inclusive to everyone.
Yeah.
I think some of the positive, it's definitely brought our family together closer, more family time in the kitchen. I think that it's also expanded their social network. So he's able to join groups like this, be part of projects, present, just talking to people on the East Coast and different states. And he's able to take some leadership roles and develop conversation skills with other people who have allergies and even people who don't. And I think that it's just exposed him to a bigger world that's greater, and it gives him like a bigger sense of purpose. And, it's tough to be passionate about anything. So we've taken allergies and it's allowed him to be passionate about that and realize he can focus his energy to something. Like I told the doctor here earlier, I wanted him to be a pilot, but he wants to become a food allergist. So he helped us.
I told him he could be both, right?
Both. So math and science, and just be passionate about something. And it's just going to make the food allergy network stronger. And I do believe the tide is turning on food allergies. I see it in the youth. The youth are, at school are much more empathetic. There is the random bullying and things like that, as someone spoke to before. But I think that, most kids are empathetic to, food allergies. So,
yeah. And bullying is an issue in school regardless, right? And food allergies just become an additional way for folks to bully. We have about less than 15 minutes left. She was very good at putting up that sign. I saw the sign, so we're good. So a couple of questions left here. And so I wanted to get into some of the advocacy. I know Alani does a lot of that here locally in Jacksonville. And in particular, we have the EpiPen in school availability in the state of Florida, and a lot of our public school systems have taken that up. But the preschools aren't on board all the time. And so Head Start training is something that Alani feels very passionate about. I just wanted you to speak on that a little bit.
Yeah, so through Mayo Clinic Community Engagement Outreach, we connected with Head Start in Florida. We were able to train 400 Head Start teachers recently. And we followed that up with a parent education session. But what came out of that initial teacher and staff training was that they are now implementing no Play-Doh in classrooms where someone has a wheat allergy. They're replacing it with gluten-free Play-Doh. They are instituting the FAIR action plan for all their centers and all their children starting in January. And I saw that FAIR updated their action plan to include Neffy now. So if you have an older one, be sure to get the new one. And the third one is to really advocate to have 2 auto-injectors at school at all times. And as I said, it's really hard for some families to do that. They are now the requirement currently is to have at least one auto-injector at school, but that's not always sufficient. So working with them to improve that. And on a different level, I'm trying to get Elijah's Law into Florida, where and that law would require early childhood educators to know how to give an auto-injector and when to give it. And when we go to these schools, it's really evident, I think, every single time we have one or two individuals or teachers who know how to give an auto-injector. But time and time again, nobody knows when to give it. And I think that's a really big gap and something we really need to educate others on. So.
Yeah, that's terrific. And Diallo, I know you had some thoughts about stock epinephrines in schools or challenges you may have had with that as well.
Yes. We, at my school, I believe 700-800 kids, and we only have 2 EpiPens for the entire school. And we were going over numbers early, and it's at least 10% in each class, that has, food allergies of some sort. So I know that if there's ever an allergic outbreak from a cafeteria, there's not going to be enough pens and things like that. So we are trying to work on, having more EpiPens for, every school in our district, because 2 is not enough for the sheer amount of people that are at the school and the number of students who have food allergies. I don't know. Did you want to talk about your teal bucket project for your school?
Yeah, I'm starting a teal, pumpkin project, and there are about 15 schools in the district, and I know that some food allergic people don't know about the teal pumpkin, and they don't know how it's so beneficial to them. So I'm gonna be giving each school in the district a teal bucket with, little stickers, glow sticks, spider rings inside, and also like a little information packet to let them see what they are and what they can do, maybe even convince them to get one for their own house.
Amari, you're a great advocate for food allergies. You really are. I appreciate all that you're doing.
His birthday falls on October 28th, so Halloween's always a tough time.
Yeah.
He's giving away all his candy and,
yeah,
it's tough. But yeah, so he's going to do the teal bucket project and
yeah,
hopefully spread awareness throughout the district.
It's great. I wanted to throw out a piece of advice for the folks who advocate for FARE. Alani and I, actually, we shared an Uber on the way here last night, and we were talking about this, and I think it's important for as FARE tries to get some of these things like the Elijah Law into different states and places like that, is to not go in on by yourself, right? So, I mean, there are medical societies, medical groups that advocate for doctors and doctors' interests. And so, like in Florida, the FMA, the Florida Medical Association, if you were able to get a resolution through that medical association to support Elijah's Law, then you can let their lobbyists do the work for you, right? You could be there with them, but that becomes part of their legislative agenda, and they're going to try to work until that thing gets approved at some point. So it's not something that has to be done in a silo. You know, the more that we coordinate efforts, the more that we work together, the more likely we are, number one, to advocate and do the right things for our patients, but number two, to educate the community, in particular medical professionals, about what allergies are and why it's important for us all to understand what people go through. Couple of minutes left here. I just want to wrap up with Amari here. You know, you've said some great things here already, but how can teenagers, young adults, people who are just getting into the professional routes advocate for policy changes and increase education when it comes to food allergies in general? How do you think that can happen?
Well, I think that can happen in many ways, such as like group gatherings. Courage at Congress was a great one, but we can also do it for like teams. And if teams come together and all advocate for one thing, that it really makes a difference, because politicians are used to seeing a lot of adults in a room and just talking to peers, but they never really get a chance to talk to the teens and see them advocate. So it's a really big deal when they do step up, group together, and advocate for a similar cause.
Yeah, that's fantastic. And Alani and Diallo, as parents and professionals, how do you look at just the community in general? So, you know, take out the fact that we are living in the allergy space, but how do you look at community members in general to advocate for food allergies and what people go through on a day-to-day basis?
I think that, well, to kind of piggyback on his answer, I think when we're dealing with advocating as far as parents of kids with food allergies and educated. I think the hardest step is taking that first step. Is reaching out to your local city council, is reaching out to your superintendent. Cause schools are really the front line when it comes to kids. And I think that parents aren't as aware that they have the ability to change things. So I think just I think the best way to do it is probably have like, local circles or local empowerment groups regarding allergies where everyone can work together, both teens and adults, and having someone guide them or showing them how to, contact city leaders, contact administrations. And so, that first step is always the hardest.
And if I could just jump in here, I'm Jason Lindy of the SVP. Thank you. Right. If I could just jump in here on this, I'm Jason Lindy. I'm the SVP of Advocacy for Fair, food allergy, child who was born allergic to dairy. So this was the worst holiday. Give away all your candy. Look, this is something that FAIR does all the time. I've worked with, Diallo and Amari and the whole Sims family. But if you're interested in advocating, just pull me aside after this panel or just send me an email, jlindy@foodallergy.org. I've worked with Alani as well. We're going to get that bill in through Florida at some point. But I would just say this is something we do as an organization because we can't be everywhere, but you are. And we want to make sure that you have the tools, and information you need to contact, your lawmakers. And I actually sat in virtually with the Sims family when they were lobbying in Sacramento, and, reached out to their own local lawmakers. So this is something we do all the time for all our families. And it's just a matter of you reaching out to me, and we'll make it happen. Thank you.
And Jason, I know you probably do this, but as I mentioned earlier, collaborating with other medical organizations or other groups that might have similar interests may open more doors even.
They do, but what I found is that they have their own agenda.
Right.
And so they all have members, doctors, for example, that pay their salaries. And so they're willing to sign letters, but they won't do the shoe leather work.
So, I guess my point is that, like, for instance, if like the FMA meeting and the AMA meeting, which I'm just going to talk about FMA for a second because I'm very familiar with that, is if you had an organization or a local group come up with a resolution for Elijah's Law in the state of Florida, and they brought it to the FMA, and the FMA adopted it as a resolution, that means that their members voted for it. Then it becomes their job as lobbyists to advocate for that. It's not just that the doctors want to get paid for their colonoscopies this is part of this is how we got EpiPens in school in Florida, is that we got it approved through the FMA as a resolution, and then we were able to get it from there. Because they have lobbyists who are in the pockets of these politicians, and that's how you get things done, as you know.
Yeah, agreed, and we'd be happy to work with the FMA. Obviously, we've had some challenges with the Florida State Hotel and Lodging Association on other issues, which we'll get to later.
So maybe we can get, because if you just get one local medical society to support it, then we could get that through the FMA, and maybe we should work together.
Yeah, it'll be wonderful.
And I would just say that I had to learn that I need to put a face to it. And even though I like to be in the background, sometimes I have to come to the front and say I am the face of a caregiver. And the other thing is it's very different for me as the allergy mom to send a message to the school saying, hey, you should have trinkets at your trunk or treat, versus a mom who don't have kids with food allergies saying, hey, we should have something for food allergies. So we should educate within our community, but we should also educate outside of our community and pull those in as our allies. Yeah.
Yes, great point. So I think that was the last question that I had, and we can open up for questions now.
Hi.
Any questions?
Everyone might be ready for lunch.
Yes, so we're going to help with wayfinding, but first I want to really thank the panel, Dr. Joshi, and all of the panelists. You've really inspired us, and there's, I think, a lot of opportunity for collaboration and learning and really expanding all of your efforts to all of our FAIR neighborhoods in all of the states that we're working in. We are going to lunch now. It is a top 9 free lunch. Should be very tasty and very safe, but definitely read all of the labels. Every dish should have labels with all of the ingredients listed. And we're going to actually go on a little field trip to lunch. So we're going to help you walk out of here and get to lunch. Thank you, everyone.